Hello. So I am going to talk about differential diagnosis and share a little bit of information about the differential diagnosis for schizophrenia or schizophreniform disorder because they are actually very similar, but we'll get into that. So first of all, diagnosis is the primary task of all clinicians or healthcare providers. Patients or clients do not typically come in presenting with a specific diagnosis. They don't come in saying, I've been having major depressive disorder for the past several months. They typically present with symptoms and concerns. The clinician is responsible for analyzing the presenting symptoms and information obtained from clinical interviews and assessments to determine the most appropriate diagnosis. It is important to maintain an open mind as additional information becomes available and adjust clinical diagnosis and treatment plan as appropriate. Cook and Dakari define differential diagnosis as the systematic process used to identify the proper diagnosis from a set of possible competing diagnoses. Accurate diagnosis improves communication between providers, use of testing, and understanding of patient prognosis, and implementation of treatment. Inaccurate diagnosis can lead to improper interpretation of test metrics, poor provider communication, inappropriate treatment plans, and overtreatment in some cases. The process of the DSM-V differential diagnosis can be broken down into 6 basic steps. Number 1, rule out malingering and factitious disorder. Concerns should be raised if any of the following criteria are met. 1, when there are clear or external incentives to the patient being diagnosed with a psychiatric condition, i.e., at a disability determination, forensic evaluations in criminal or civil cases, or in prison settings. 2, when the patient presents with a cluster of psychiatric symptoms that conform more to a lay perception of mental illness rather than to a recognized clinical entity. So if someone's presenting with a disorder like you would see in the movies or on TV or very media presented type of like dissociative identity disorder, for instance, or schizophrenia. 3, when the nature of the symptoms shifts radically from one clinical encounter to another. 4, when the patient has a presentation that mimics that of a role model, like another patient on the unit or a mentally ill close family member. Or 5, when the patient is characteristically manipulative or suggestible. Step 2 is rule out substance etiology, include drugs abuse and medication. In diagnosing a substance-induced disorder, there are 3 considerations in determining whether there is a causal relationship between the use of substance and psychiatric symptomology. 1, consider whether a temporal relationship exists between the substance or medication use and the onset or maintenance of the psychopathology. 2, consider whether the nature, amount, or duration of substance medication use are consistent with the development of the observed psychiatric symptoms. Or 3, consider other factors in the presentation that suggest that the presentation is not caused by a substance or medication. In some cases, the substance use can be a consequence or an associated feature rather than a cause of a psychiatric symptomology, as in self-medicating anxiety with alcohol. In other cases, both the psychiatric disorder and the substance use can be initially unrelated and relatively independent of each other, as substance use disorders and psychiatric disorders are frequently comorbid together. Step 3 is rule out a disorder due to general medical condition. Virtually any psychiatric presentation can be caused by a direct physiological effects of a general medical condition. These are diagnosed on DSM-V as one of the mental disorders due to another medical condition, i.e. something like depressive disorder due to hypothyroidism. This differential diagnosis can be difficult for 4 reasons. Symptoms of some psychiatric disorders and of many general medical conditions can be identical, like symptoms of weight loss and fatigue can be attributable to depression or anxiety disorder or to a general medical condition. 2, sometimes the first presenting symptom of a general medical condition are psychiatric, like depression preceding other symptoms in pancreatic cancer or a brain tumor. 3, relationship between the general medical condition and the psychiatric symptoms may be complicated, as in depression or anxiety as a psychological reaction to having the general medical condition versus the medical condition being the cause of a depression or anxiety. via its direct physiological effect on the central nervous system. 4. Patients are often seen in settings primarily geared for identification and treatment of mental disorders in which there might be a low expectation for or familiarity with the diagnosis of medical conditions. So if you present to a community mental health center where there are no medical providers, they might not be looking for medical conditions. There are 2 clues suggesting that psychopathology is caused by the direct physiological effects of a general medical condition. The first clue is the nature of the temporal relationship. It requires consideration of whether the psychiatric symptoms begin following the onset of the general medical condition, vary in severity with the severity of the general medical condition, and disappear when the general medical condition resolves. The second clue that a general medical condition should be considered in the differential diagnosis is if the psychiatric presentation is atypical in symptom pattern, age of onset, or in its course. If you have determined that a general medical condition is responsible for the psychiatric symptoms, you must determine which of the DSM-V mental disorders due to another medical condition best describes the presentation. Step 4. Determine the specific primary disorder. So this could be based on the presenting symptoms, which main class of disorders would be most appropriate to start looking at. Step 5. Differentiate adjustment disorders from residual, other specified, or unspecified disorders. So if it doesn't fit neatly into a major specific disorder or doesn't meet all of the diagnostic criteria, it might be a residual, other specified, or unspecified disorder. And step 6, the last step, establish the boundary with no mental disorder. To be explicit that not every such individual qualifies for a diagnosis of a mental disorder, the DSM-V includes, with most criteria set as a criterion, the disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. A decision tree can be used for diagnostic decision-making and presenting symptoms, or a decision table can be used to confirm or deny a specific diagnosis. So for the following differential diagnosis for schizophrenia or schizophreniform disorder, schizophrenia and schizophreniform disorder, which are characterized by a disturbance lasting for months, at least 6 months for schizophrenia, and between 1 and 6 months for schizophreniform disorder, that significantly impair function and include at least 1 month of active phase psychotic symptoms, must be differentiated from, first of which is psychotic disorder due to another medical condition, delirium, or major neurocognitive disorder due to another medical condition. So the criteria for this would be, it requires the presence of etiological general medical condition. Schizophrenia or schizophreniform disorder are not diagnosed if the psychotic symptoms are at all due to a direct physiological effects of a medical condition. It can be differentiated from substance or medication-induced psychotic disorder, or substance medication-induced neurocognitive disorder, substance intoxication, delirium, substance withdrawal delirium, medication-induced delirium, substance intoxication, or substance withdrawal by requiring that the psychotic symptoms be initiated and maintained by substance use, including medication side effects. And schizophrenia and schizophreniform disorder are not diagnosed if the psychotic symptoms are all due to direct physiological effects of a substance, including medication. It is differentiated from schizoaffective disorder if it's characterized by symptoms that meet criteria for major depressive disorder episode or a manic episode, and the mood episodes are present for the majority of the total duration of the active and residual portions of the illness. In schizophrenia or schizophreniform disorder, the mood episodes have been present for a minority of the total duration of the active and residual periods of the illness. It is differentiated from major depressive disorder with psychotic features, bipolar I, bipolar II disorder with psychotic features, catatonia associated with major depressive disorder, catatonia associated with bipolar I or bipolar II disorder by being characterized by psychotic or catatonic symptoms that occur exclusively during manic or major depressive episodes. So if the symptoms occur outside of manic or major depressive episodes, they would meet criteria for schizophrenia or schizophreniform disorder. Brief psychotic disorder is differentiated by a total duration of psychotic symptoms of at least 1 day, but less than 1 month. So same psychotic symptoms, but the duration is shorter. Delusional disorder is a differential diagnosis that is characterized by delusions occurring in the absence of other characteristic symptoms of schizophrenia, such as prominent auditory or visual hallucinations, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms. It is differentiated from post-traumatic stress disorder by being characterized by flashbacks that are hallucinatory quality and hypervigilance that may reach paranoid proportions, but PTSD is distinguished by the requirement of exposure to a traumatic event with a characteristic cluster of intrusion, avoidance, and other symptoms. Schizophrenia and schizophreniform disorder are differentiated from autism spectrum disorder by being characterized by an early onset. Autism is characterized by early onset before the age of 3 and an absence of prominent delusions or hallucinations. A diagnosis of schizophrenia or schizophreniform disorder is warranted in individuals with pre-existing diagnosis of autism spectrum disorder only if prominent hallucinations or delusions have been present for at least 1 month. Finally, schizotypal, schizoid, and paranoid personality disorders are differentiated by being characterized by personality features that are subthreshold versions of many of the symptoms of schizophrenia, such as odd beliefs, perceptual distortions, odd thinking and speech, or social anxiety. So, having said that, final conclusion, schizophrenia and schizophreniform disorder have essentially the same differential diagnosis and thus have been combined for the purpose of this differential diagnosis. They are differentiated primarily based on duration of disturbance. So, thank you very much.